Such an honor to welcome you, Congresswoman. You've done an amazing job with the Progressive Caucus, who we love. And one of my personal all-time favorite pieces of legislation is your Medicare for All Act, which you've taken over from Mr. Conyers and built on his legacy to improve the legislation. I think it's important for people to understand that it explicitly protects reproductive freedom, which is so important these days. And I think that that should be one of the cornerstones of everybody who's running for office, to protect women, protect families, protect our health, and protect people from going bankrupt because they get sick or injured. So thank you so much. It's such an honor to have you here.
It's great to have you, Congressman. We have 50 people on. We're live webcast on YouTube, and this will be rebroadcast on the Progressive Radio Network on Thursday night. We have a heavy focus on healthcare, and we have a great doctor with us who's active, Dr. Nancy Naparko. But it's an honor to have you with us. Thank you.
Thank you so much for having me. And most of all, thank you for the incredible work that you all are doing to keep our movement for universal healthcare and Medicare for all alive and well. For those of you that I don't know, Congresswoman Pramila Jayapal, I represent Washington's 7th Congressional District. And I also have the great honor of serving as the elected chair of the Congressional Progressive Caucus, about 100 members of the Democratic Caucus. And just so grateful to Progressive Democrats of America for everything that you do and for having me on today. So as has been mentioned, I am really proud. It's probably my most significant prideful accomplishment to be the lead sponsor of the Medicare for All Act. This is our country's most comprehensive plan to transition to a single-payer universal healthcare system that finally puts people over profits. And it is the change that we need to see in our healthcare system to ensure that everyone can receive the care they need. And every year we have been doing the work in Congress to actually make this a reality. Obviously, John Conyers had HR 676, the resolution for universal health care. Bernie Sanders introduced a Medicare for All bill into the Senate. And this Medicare for All Act is the first comprehensive legislation that shows how we're going to get from where we are to where we need to go. Most importantly, every cycle we get more members of Congress co-sponsoring this legislation. I wish I could tell you that we had all Democrats co-sponsoring it. Unfortunately, the lobby, the private insurance lobby, has been absolutely intransigent in fighting Medicare for all. And frankly, we also have a president who, while we agree on many other things, this is not his answer to healthcare. And so what we have been doing is trying to build the inside movement for Medicare for all. And on the Medicare for All Act of 2023 that I introduced last year for this cycle, we have 112 members co-sponsoring the legislation. That's more than half of the House Democratic Caucus, and thanks to all of you, it also includes many of our powerful committee ranking members, which was a key area that we were focusing on this year again. It's a big number, but it's not enough. However, we would not be where we are without the organizers on this call who have been pushing in your own part of the country to get more co-sponsors in. And so I hope we can continue to work together to make that number grow. We all know that our healthcare system is broken and that more than 25.3 million Americans of all ages were uninsured in 2023. Perhaps the more stunning statistic in a way, I don't know if it's more stunning, but equally stunning statistic in a way, is the number of Americans who were underinsured. 43% of Americans underinsured, meaning that even if they had insurance, it wasn't sufficient to make healthcare coverage affordable. And we have millions of people who are drowning in medical debt. And so I think when we look at the COVID pandemic, we made the argument very clear that healthcare cannot be tied to employment. 27 million people lost healthcare when they lost their jobs. And of course, it was Black, Brown, Indigenous people, and poor people who suffered the worst losses. So as we think about the path for Medicare for all, we also have to be looking at what our enemies, our opponents, are doing, because they understand that the Medicare system is extremely successful. And there is a lot of work happening right now to privatize the Medicare system, because they know that Medicare for all is not only good legislation, it's popular. It's supported by 70% of registered voters. It's been endorsed by over 100 local governments because people know that they deserve and want comprehensive health care. And that includes, as you said, reproductive care. It also includes mental health, such a big issue in our country today. It includes long-term care. My bill was the first bill that included long-term care into Medicare for all. It, of course, includes dental, vision, and hearing. It includes gender-affirming care. And all of that with no copays, private insurance premiums, deductibles, or other hidden fees. And so when I look at some of what we've been doing, our work to secure the first ever hearings in Congress a couple of cycles ago was transformative. It was a big stepping stone to making it clear that we could start debating Medicare for all in the House, and we're going to continue to do that. But I also think that the work now has been to stop a lot of the privatization of Medicare, whether it's ACO REACH or what I call Medicare Disadvantage. These are programs to privatize Medicare, and they're hidden in so many layers of bureaucracy that the average person doesn't even know what's happening. And in their view, we may get to a single payer healthcare system, but it'll be United Healthcare that's providing the single payer healthcare system, not the federal government. So we have a real challenge on our hands in terms of stopping that. Because those are the programs that trick people into getting worse coverage for more money, which means more patient claims denied, more necessary treatments missed, more patients falling through the cracks. One of the things that we've been pointing out, because we're always told that Medicare for all, there's no money for Medicare for all, even though, we continue to give hundreds of billions of dollars to the Pentagon, the only unaudited federal agency in the country. But somehow when it comes to universal health care, we don't have the money. Well, here's the thing. If we were to just reinvest the $46.5 billion that Medicare Disadvantage programs overcharge the government, we could lower Medicare premiums, we could completely eliminate deductibles, and we could expand benefits to include dental, vision, and hearing for all Medicare beneficiaries. So it simply isn't true that we don't have the money. We're just spending money on the wrong things. I think to reach our eventual goal of a comprehensive Medicare for all system that provides healthcare to everyone, we have to ensure that we are preserving the traditional Medicare system, and then we are building on it by reducing the eligibility age, by expanding the benefits, and by electing more people who are ready to take on the private health insurance system and show their commitment with a vote on the House floor and the Senate floor. So my commitment to you is we've shown what we can do together. We've made enormous steps forward, and we can never stop fighting for this because it is urgent. And my top priority that we finally guarantee healthcare to everyone as a human right. So thank you all so much for everything that you're doing, and really looking forward to continuing to build that movement together and getting it done.
Well, this should be the number one issue in this election. It's just killing all of us to see the degradation of the public dialogue when this is the most important issue. My parents, thank God, my mother's mantra in her last years was thank God for Medicare. And what's missed about universal health care is, allegedly a lot of it's for old people, certainly Medicare. But if I was in my 30s and 40s when my parents, took ill, and if it hadn't been for Medicare, I couldn't have put my kids through college. All our money would have gone for their medical care. We wouldn't have had a house. I couldn't have taught school.
Right.
None of that. So, Congresswoman, you are really a saint with this. I mean, we totally It's music to my ears to hear this, and I hope to God we get it. We have an actual medical doctor and a great activist, Dr. Nancy Naparko. Nancy, do you want to jump in here with the Congresswoman?
Yes, thank you. It's a real privilege to talk to you. I have to say, I don't donate outside of California very much, but I donated to you and your sister, and I'm so disappointed she didn't make it. She needed to be there.
I totally agree with you.
I want to know, we're never making enough headway on healthcare for all, but the ACO REACH is really a big step backwards. And I know you and Senator Warren were pushing that letter. I don't know what happened after that.
Well,
Where is it?
Yeah, so ACO REACH is essentially the privatization of Medicare. It's the ability for these private insurance companies to provide care, calling themselves Medicare when they're not, and they're essentially overcharging people, under delivering. The healthcare results are significantly worse. This was a program that Donald Trump put in place, and so it was a real priority of ours to get rid of it. We were not able to get rid of it, but we have been successful at making many changes to the program. It's not sufficient, but we were able to get a number of of the partnerships ended. We have been continuing to push for changes to the formula so that these companies cannot overcharge us, overcharge taxpayers and overcharge Medicare. And so that effort is still continuing. The ACO REACH program still exists. It just exists with better rules, but it's not sufficient. And so we are still totally in favor of ending it. We are continuing to try to do that. We've only made half steps towards it. Senator Warren and I have been pushing, and every single time we're talking to CMS and Secretary Becerra and pushing for changes to be made. The private health insurance companies have a lot of leverage, unfortunately, because somebody in the chat put that half of Medicare beneficiaries are in Medicare disadvantage. That's right. And so what the private insurance companies are doing is they're saying, if you change the rules on us and you make it harder for, you take away the ability for us to charge all this money, we're going to pass it on to the beneficiaries. And so again, one of our strategies has been, let's try to get as many seniors as possible off of Medicare disadvantage back onto traditional Medicare. And that is happening more and more, but we need a real effort around educating people about Medicare disadvantage.
Thank you.
Thank you. And I want to very quickly slip in, because we're going to focus the call on Paul Newman next. We're up to 62 people. One of the major works of these calls is to shut the nuclear power industry. You have one reactor left in the state of Washington, the Columbia Generating Station. Makes absolutely no sense in terms of the environment or the economy to keep it operating. So we can talk about that later, but we want that reactor shut as soon as possible. We have more than enough renewable resources in Washington. You probably know, but today is the parole board hearing for Leonard Peltier. And we are strongly supporting his parole, and I'm sure you've weighed in on that too.
I have.
Okay, as well as getting Julian Assange.
I co-sponsored that resolution as well. Yeah.
Very good. Thank you so much. Okay, we got Paul Newman as a regular. He's the only guy on our call that has a picture of Franklin Roosevelt over his left shoulder. Paul, go ahead.
Hi, it's nice to see you again, Pramila. I saw you in Los Angeles a couple years back at Paul Song's house when he had a get together. But anyway, here in California, we had a bill called AB 2200. First of all, are you aware of that?
Yes, I think so. Isn't that the one that
Ash Kalra
was? Yeah. Mm-hmm.
Right. He authored, or he worked with the nurses actually on that one.
Yeah.
But anyway, we had this bill. It passed the the Health Committee in the California State Assembly. Then it went to the Appropriations, and Buffy Wicks, who's a Democrat who originally supported AB 1400, which is practically the same bill, put it in suspension, which means that they needed to examine it for fiscal impact. And the bill is a policy bill, which means that in order to get the 1330 waiver. Are you familiar with 1330 waiver?
Yeah, I had the original bill. I gave it to Ro Khanna, but I had the original bill to address the waiver to make that more available to states to be able to move on universal health care. So Ro Khanna has that bill now when I took over Medicare for All legislation.
Oh, good. But
So
anyway, what I was
my
gonna say-
understanding, Paul, is that we had some good legislation, and Gavin Newsom jumped ship. Is that right?
Well, Gavin Newsom went into the committee and had Buffy Wicks and the other members put it in suspension, which means they want to look at the fiscal impact. But the problem is that bill had no fiscal impact. It was a policy bill in order to apply for the 1330 waiver. So if it passes, they still have to get the 1330 waiver for there to have any kind of fiscal impact. And to me, that appears to be corruption. And I just want to let you know, there are a lot of Democrats and Gavin Newsom, who ran on single payer, have been betraying the people. And people are dying. People are going into bankruptcy. I mean, it's really bad. And this bill would throw out Medicare because it's a better bill than Medicare because everybody's covered and it's, the state funds it and it's privately provided. And I mean, it's just unbelievable. And I just want to know what your thoughts about that is.
Well, I haven't closely, obviously I'm not from the state of California, so I haven't closely followed it. I just heard some of the top lines on it. And look, I think this is the challenge, right? We need people who are bold enough and brave enough to take on the private insurance companies and who put a lot of money. I read somewhere that there's like 300 or 400 lobbyists for those private insurance companies for every member of Congress. And I'm sure that's true in the state of California as well. And so I think that is the challenge we have. It is not easy. We should have every single Democrat on Medicare for All, but we don't. So we know what our task is. I'm not daunted. Sometimes I'm, frustrated and angry, but I'm not daunted by what it's going to take to build our movement. And that's why I'm on this call today, because I think it's important that every person is talking to states can make the argument that if they can't get the federal flows of money from the federal government, then it makes it very difficult. Now, California is in a slightly different situation because you're so big that you have the numbers. But I think for a lot of the country, we need the federal legislation. And in order to get the federal legislation, we need more people who are willing to take it on. And I think that's what I'm working on. And we have a Medicare for All caucus now in Congress. You can check to see if your member of Congress is in that. You should check to see if your member of Congress is signed on to Medicare for All. We also, by the way, have a Medicare for All calculator that I would urge everybody to utilize and use in your efforts, because I think it's a way to show people how much money you would save, and once again to build that that understanding from the bottom up. But I totally hear your frustration, and believe me, I have faced it with my own fellow Democrats who don't want to sign on to Medicare for All. That said, we're getting more and more of them on, and it's a partnership between the movement on the outside and the movement on the inside.
Well, it's absolutely essential that we get this. I mean, having experienced the passing of elderly parents and now being one myself, it's impossible to navigate life in this country without universal health care. It's insane that we don't have it. And you are a true hero for doing this. Hetty Tripp, do you want to join us from Minnesota? And then Wendy Liederman in Florida. Oh, I had you unmuted. You're unmuted, Hetty. Please. Hetty is a great activist working on safe energy issues
You have
in
turn
Minnesota.
your other instance on. She's got two instances going on.
Okay.
There you go.
Can you hear me now? Okay.
Yeah, please.
Hi, Pramila.
Hi,
Good to
Hetty.
see you. Yeah.
Good to see
Yeah, I met you when I was chair of the National Asian Pacific American Women's Forum years ago.
Yeah.
In terms of reproductive justice and health, do you see it being undermined within the Medicare Act, or will that keep strong?
No. I think we are very clear, and we've built a really strong coalition for reproductive justice, for gender affirming care, for long-term care. I mean, we've really taken a lot of the things that have been excluded from our traditional healthcare system and made sure that they are integrated. So I feel like we have we are pushing for healthcare for everyone, everybody and nobody out.
Fantastic. Hetty, did you have more?
No. Good.
Okay, one other thing we do on these calls, Congresswoman, is we are very focused on grassroots organizing, door-to-door personal campaigning. We have the great Ray McClendon on with us. Ray is in Atlanta, and he actually helped organize the movements that brought us the 2 Senate seats in Georgia, the impossible dream of electing a black man and a Jewish guy to the U.S. Senate simultaneously from Georgia, for God's sakes. I'm a historian. I can tell you, you know how impossible it is. Ray, would you like to say hi to the Congresswoman, please? Ray is a generational.
I want to say hi, and we appreciate all of your hard work and everything that you're doing on all of the progressive issues that we are trying to support on the ground here in Georgia, and we're also working through the group that I'm president of, Communities United for Justice, along with Center for Common Ground and Andrea Miller's group. We're working in several states, primarily in the Southeast, to encourage folks to get involved civically and then to vote. And we're doing that through a number of grassroots coalitions. So we thank you for everything that you're doing. And I wanted to follow up on the Medicare for All question, if you would, which is, how do we get more people to understand the significance of universal health care and what it will do for them individually? Because it's the individual pain point issue that I think is most important to galvanizing the support for it.
That's right. Exactly right, Ray. And thank you so much for all the work that you've done to deliver Georgia for us in the Senate. And, we're going to have to obviously continue to make sure that people are turning out both for the House seats, for the Senate seats, and for the presidency. So I really, really appreciate that work you're doing. Look, I think the calculator is an attempt to show people that economic pain point. What do you pay right now? So you can, it's because it was originally utilized, I think, in California, and we asked the makers of it to make it available for everybody. So the Medicare for All PAC funded that effort, and now you can plug into it wherever you are in the country, and you can put in your family size. And so if you haven't used it, I think that's just a great way on the doors to say to people, hey, check this out. Let's do it right now. What do you how many family members do you have? What do you pay right now in deductibles? What do you pay? And because I think people don't always recognize that they're paying every time you go to the doctor. If you pay $20 or $50, your medicines, your deductibles, if you add all of that up, it's an enormous amount of money in addition to the healthcare premium if you're lucky enough to have health insurance. And so that is one way that we're trying to really help people understand what is the economic impact of this on us. And then I think the other thing is for a great organizer like you, one of the things I've been doing in Congress is having these discussions with members of Congress, just with members of Congress, about how much we spend on healthcare in this country and how bad our results are. And so I think the extent to which you can have community conversations in your areas, bring together a group of people, have people tell stories about, who they are and what they're dealing with as far as healthcare goes. I think that is really, really important, because the more we can make this tangible for people, the more important it is. And then the last thing I would say is focus on your members of Congress, please, because they need to hear from you. And I'd have to go back and look at who in Georgia. I know Nikema Williams is on Medicare for All, of course, but I don't know about the rest of the the members of Congress in Georgia, check your members of Congress for every state, whatever state you're from, and then try to do the grassroots organizing in those districts to get those members up to speed about what is happening and take people in, as we always do in grassroots organizing, to tell their stories about why the system does not work. I mean, the fact that we have the uninsured is now becoming the new, the underinsured is now becoming the new uninsured, right? Like these are people who are paying enormous amounts of money for healthcare, and then they're doing GoFundMe campaigns, or they're going into medical debt because they can't afford healthcare. How crazy is that? It's a real crisis just to be underinsured in this country.
It's terrifying. I think most people in this country live in terror of medical problems. And I want to mention Ray has been integral. We're on Thursday, we're going to go live with a website, everything you need to know about grassroots organizing for the upcoming. And I know Mike is in touch with your staff, so we'll make sure that they have it. And Ray and Andrea Miller have been the masters and have taught us all about relational organizing. It's made a huge difference.
Oh,
Ray,
so important.
Yes, it's the key. It's the only way we're going to prevent a dictatorship in this country. I don't have to tell you. Ray, is there anything you wanted to add in before we move on?
No, that's it. Thank you.
All right, thank you so much. Wendy, I can't unmute you. I don't know what's going on here. Vinny DiStefano, let me jump to you real quick. Congresswoman Vinny DiStefano has been key to the Assange campaign, and also with Leonard Peltier. Do you want to say hi to the Congresswoman?
Yes, first and foremost, you're an incredible congressperson. You really are. And thank you for your signature on the Paul Gosar's letter. I know it makes for very strange bedfellows, but this is the key issue for us here. If we wish to have dissent, if we wish to have freedom of the press, not just here in the United States, but around the world, the precedent this sets is frightening. However, I'd like to go back to the single payer. I live in the Soviet of California. The Republicans tell us what this world would be like if the Democrats were in charge. Well, we have supermajorities in the House, supermajorities in the Senate, pretty much every elective office. Our governor and our Congress refuse to even bring single payer up for a vote. And we all know why. Because if they voted yes, they lose all the money from the pharmaceuticals, the HMOs, and all of the other people that fund their campaigns. If they vote yes, if they vote no, well, then they lose the voters. So no vote means no health care. And if we can't pass it here, what do we need to do? Because the sad thing is, even 65% of Republicans, when single payer is explained to them as you've just done so well, and 85% of Republicans agree on something, and our elected officials refuse to listen to what the people demand. Well, we don't live in a democracy then. We live in a dictatorship and not of the proletariat. So what can we do to overcome that reticence of Democrats to do the right thing, as they refuse to do here in my home state?
Well, I think you have to hold them accountable, right? You have to hold them accountable. You have to make it count in the elections. People who care about this issue have to be really clear that this is a top issue and that they need to see progress, but you also have to organize on the inside and the outside. And you guys did. I'm not saying you didn't. Like, that was an amazing effort to get it to the place that you got it. But I think I was on a call with Ash shortly after. I think that they didn't have enough votes. That's what happened, is what I heard. And so this is a frustration in Congress too. I mean, we don't have enough votes. And so we have to figure out, because the political system is based on the number of votes you can get, you have to figure out how you can get that number of votes. So it really is the grassroots organizing. Again, I would just say that the state-based, there are a lot of challenges. I think California can overcome them because of your size.
The sixth largest economy in the world.
But there are a lot of challenges with not having, it's why Roe's bill, my previous bill, but the bill that Roe now leads on state-based universal healthcare is important, because you need to find a way to get the federal funds to come in. This is a problem that Vermont actually had as well when they passed universal health care at the state level, but then they weren't able to access the federal funds and the whole effort sort of fell apart. So it ends up being a reason why a state can't do it if they can't access the federal funds. But I also think that this has to work at a national level. I mean, I think,
Of course.
we need to get those, because most of the California members, I think, are on Medicare for All. There are only a few of them that aren't. But this California state legislature, people run on it because it's popular, but then they don't follow through. And
Exactly.
there has to
Do
be
away with Citizens United, perhaps, and take the money out of politics, and then they won't have the power.
Exactly. That's HR 1, which, we
Yes.
passed in the House multiple times. And if we can get the trifecta back, that is at the top of our list, is the structural reforms to really make sure we're changing the rules that are benefiting the wealthiest corporations and individuals instead of working people.
Right.
Sluggo, I don't want to interrupt, but I understand that the Congresswoman has a hard stop now, and we would love to have you back, because we're just scratching the surface of all the wonderful things you're doing.
You're a great guest. Thank you so much. I want to point out very quickly, we also had a deal with Gavin Newsom to shut the Diablo Canyon nuclear plant, and he backed out on that. So I just want to keep you posted on that. We do not want more nuclear power. You are a great guest. I hope you will come back. We have 73 people with you and live on YouTube and the whole deal. So we certainly support everything you're doing with Medicare for All, and whatever you need from us, let us know. We'll get you the guide to grassroots organizing. You don't need it, but we'll spend it on them.
That's why I love being with you, because that's what I did for 2 decades before coming to Congress, is grassroots organizing, and I still believe that that's the answer. So thank you all so much. Check your state members of Congress in your state. Make sure they're on Medicare for All. That's one thing I would ask, is just turn up the pressure if they're not, to get on as a co-sponsor in the bill. And thank you, Progressive Democrats of America.
Thank you.
Appreciate
Take
you.
care.
Take care.
No news.
Thank you.